Okay, so now I'm going to try to take our model that we've been using for New Jersey and apply it to Florida, all right? So if you've been reading the news at all, you know that Florida is one of the states that's been having a lot of problems, all right? So Florida, Texas, and California are all the most populous states. All three of them are having significant problems. I'm going to track Florida because, you know, that's where older people from New Jersey go to retire. So I'm very interested in what might happen in Florida over the long haul. So let's see what the model would look like and how to take our model that we had for New Jersey and switch it over pretty quickly to model what's going on in Florida. Okay, so the starting point is to find data for Florida, right? So to do that, it's actually quite easy. Our friend Wikipedia comes into play here. And I went to the same page for Wikipedia that I had for Florida. Okay, so as we look at this, we can see here's the whole page, but what I'm interested in for our model is the data for deaths, right? Now there's the data for the last 15 days, but I can open this up and do everything back into March, right? I won't open all of those up right now, but you can see, unfortunately, they don't have the data all the way through July. Get rid of the last 15 days. Let's include July, June, and July. This is only updated through July. Oh, actually, that's pretty good. Right now, it's updated through July 9th, and it's only July 10th. So we have some pretty good data, okay? But you can also, if this doesn't have all the data you need, you can use this Wikipedia kind of link for pretty much any state. It tells you where it got the data from. So if I click on this link down here, Florida Department of Health, we go to the Florida dashboard. Now, the Florida dashboard isn't quite as good as the New Jersey dashboard. It doesn't have a good hospital census, which is vital to being able to know what to do. So I don't like their dashboard as much, but we do have a death total, okay, that we can use. Once again, these are probably confirmed deaths. So we can use that data and pick up the data for today even to add to the model. Okay, but it looks like Wikipedia is fairly up to date now, so we can use those numbers that were off of there. Okay, in doing that, I'm going to now switch. I'm going to stop this share, and I'm going to switch over to sharing MATLAB again. Okay, so here we are in MATLAB. I took my model, my version 3 that I had here, and I just switched it over to Florida, right? And the first thing I did is I simply took all of the data that I had for New Jersey and I got rid of it, right? And then I put in data that I had. Now it looks like there's, I did this yesterday and they hadn't updated all the data in Wikipedia, so I can probably get a slightly better match of the data from Wikipedia if I were to go back and do that now. But I've added all the way up to what was in the, on the page for Florida as of this morning. Okay, so this last number was what was in the database just a couple of hours ago. All right, so once you have that data in, the important thing is you're going to have to rematch the data. Okay, so in order to match the data for deaths, you have to look at plot choice 5. And the Florida data, so far they haven't had that many deaths, all right, which means they have a lot of susceptible people left in their population. They're not anywhere close to herd immunity like New Jersey might be. So I have to use a pretty small Y scale in order to see what's happening with the deaths, all right? Let me take this Y scale, let me go back to about 40 weeks to shorten that up. And we can see how our data is matching up, okay? So I had to change these A values a lot, okay? These are not the A values for New Jersey anymore. So I went back to the beginning. In fact, I also had to change the initial number that I thought were infected. And then I went back to the beginning and started changing these A values to get them to match the data. Right. Now I only matched the A values up to week 25 to get a pretty good data match here. And then I speculated that after week 25, Florida would follow a path similar to New Jersey, where they keep upping the number, they keep loosening things up little by little by little. So the A value keeps climbing to a value of 3 in week 38. And if we do this, so we'll see that Florida does not have a rosy picture. Okay, so if you're going to, let me just reiterate, if you're going to model a new state, you have to replace the data for deaths because right now the code you have has the deaths for New Jersey, which would not be applicable at all. And then you have to go back and change the A values to match the data. If you use the New Jersey A values, your black line will be way above where the data is. Okay, so we had to lower the initial amount of people who were infected. The I0 value had to go down a bit. I had to change these A values fairly significantly to model what was going on in Florida. Since they had a far lower number of initial cases, they didn't really see a big uptick, and these numbers are about 1/10 of what the numbers are in New Jersey as of now. Okay, so up to the present, that Florida is at 4,000 deaths. Oh, and one other thing that does need to be changed is if you go down to the DD data, okay, we want to look at the deaths as a fraction of the population. So for Florida, it's important that I made the population is 21.5 million. New Jersey was closer, it's really 8.8 million, so close to 9 million. New Jersey's more like 20 million, so it has more than double the population of New Jersey, yet the number of deaths right now, 4,009, is about 1/3, actually a little less than 1/3 of the deaths in New Jersey for a population that's twice as big, more than twice as big. So we have a much lower ratio of deaths, a percentage of deaths that's much lower, so the A values need to be matched to that. Now, once those A values are matched, I can see how this might play out. Okay, so let me go to plot choice 6, and let's look at the full scale. And if I look at what happens, this is bad news, okay? So you can see if we look at full scale, let's go out to week 60, okay, a little longer than a year, and see what happens over that time period. Okay, so the dashed blue line, once again, is about when schools open, okay? So you can see that Florida didn't have many people at all getting sick early on. So up until the present, the susceptibility has barely dropped, okay? So it's still probably somewhere around 90% of the population who are still susceptible. In fact, we can see how many people have been removed according to this model. So removed for week 27, or recovered, maybe we should say, about 7% of the population. So while New Jersey's at about 60%, according to this model, the same model would predict that Florida is only at about a 7% immunity level right now, okay? So they didn't really have much of a first peak in infections. You can see they're about to hit a big red peak of infections that is going over the dashed line, the hospital threshold. I readjusted the red line based on their hospitals being near capacity now. And so the red line is lower for them in terms of how many they can have, in terms of their ability to handle more people in the intensive care units. That number is lower than it was for New Jersey. So they're reaching a point where they could be hitting trouble shortly. Okay, in fact, they're right about there. I think my model has a bit of a lag, so I think they're almost at the point of having trouble. My model shows that the real trouble is going to happen in a few weeks, right? So let's shrink the scale down and look at infections. So let's shrink the scale down to about 0.2. And you can see that they are surging towards that hospital threshold line. They're going to go over it very soon if they make no changes. All right. And they're going to have a huge peak in infections. They're going to be their hospitals will have been overloaded well before school starts, and they would have a huge peak in infections right before school is going to start. So I would suspect they wouldn't be able to open the schools the way New Jersey would if they do nothing. Okay, so this predicts what would happen if they just continually keep opening things the way New Jersey has, right? So Florida needs to follow a different path, all right? Clearly, instead of going up, they need to bring these numbers down, okay? So let's drop these numbers down. Let's say they, start closing bars. Maybe they start closing restaurants. And we keep on going. Week 32, let's take this down to 1.2. They keep tightening up. Maybe they don't do a complete stay at home all at once, but then by week 32, they're down to 1. And then by week 34, they can go down to, say, 0.8, and then they can bring this down. Let's go all the way down to 0.6, all right? And then let's see what would happen. I'm going to keep week 38. That's right when school would open. If they were strict for the rest of the summer, let's see what that would do in terms of allowing schools to open. Okay, so you can see they would be able to stay below their hospital threshold if they keep adding restrictions and improving testing over the course of the summer, and they get themselves back down to 0.6, which is very low. That would be hard to do. In fact, let's just assume that stays around 0.8. Okay, maybe with good contact tracing, they can keep their economy going, maybe allow outside dining with people wearing masks when they're walking around. Maybe they can do that. They clearly can't open up schools to the same degree that New Jersey can. They're still going to have a big spike afterwards. So maybe they can open up schools and be a lot more careful and let's see what happens if that number were 2.0. Okay, it looks like maybe they could. They just need to eventually, when they open up schools, they're going to have greater precautions than we've had. Okay, so they can't follow the New Jersey model of slowly opening things up because they're in a bad state right now. They need to actually start bringing things down and making sure that their A values are lower. So that maybe by the time schools are supposed to open, they could open them with caution. Probably not as freely as New Jersey schools can open. Now remember, a rate of 3 with our current contact tracing means we have a lot of freedom. So a 2 would still allow for a fair amount of freedom in week 38. Looks like maybe they need to keep that down to more like a 1.6 or so. If they can do that, they'd be able to ride this out and things would look pretty good. And if we go out to 2 years, according to this model, everything would be fine. Okay, so obviously after week 38, they probably could start bringing this up. Certainly by week 50, let's put in a high A value starting in week, actually let's go with week 45. So that's about where the peak is. 45, I'm going to put in a value of 3 for the A value. Oh, that probably isn't good, okay? But if they wait till the end of the year, let's put that out of week 52. Their spring semester could be great, okay? So the state of Florida needs to be careful. The governor gave me a call. I would tell him, if you want to be able to open schools in the fall, you need to take measures right now to bring your transmission constants way down so that you could open in the fall with caution. And then by the spring, you should be through this and you should be able to open up more fully in the spring. So the Florida model looks a lot different than the New Jersey model. They need to be careful now, as do most of the southern states and California. They need to start dialing things back now if they're going to avoid a disaster of going over the hospital threshold line. That seems to be, once you fill up all of your intensive care unit beds, things are not going to be good. So they're going to have to follow a very different plan than New Jersey. So it's important that, at the federal level, we don't try to use one plan for everyone, because Florida is extremely different than New Jersey.